COVID-19, a special half-hour show we get to each day wherein we'll tell you all the developments on the pandemic. Even as cases continue to spiral globally and domestically and lockdown 4 continues to be observed, attempts are being made to bring back normalcy back into our lives. Domestic flight operations have begun from today, but limited flight operations will begin for Andhra Pradesh from 26th of this month and West Bengal from 28th of this month. We get you more on this, and also we get you global updates on the virus, input from our reporters and words of wisdom from the doctors which prove beneficial for you in keeping you safe in these times. Also, we get you a special report from Sangli district in Maharashtra, which shows how responsible behavior can help us stride through difficult situations as severe as COVID-19 too. What is it that residents here are doing? We get you the details. Stay with us for the next half hour. We first begin with the headlines. Railways Minister Piyush Goyal appeals to all states to cooperate with railways for smooth transportation of migrant workers. Says Railways successfully runs 3,000 special trains to carry migrant workers to their home states. Bookings begin for 100 new pairs to be run from 1st June. Domestic flight operations begin from today. Limited flight operations for Andhra Pradesh from 26th and West Bengal from 28th of this month. Health Ministry issues guidelines for international arrivals at air, land and sea ports. Mandates a 14-day quarantine with 7 days of institutional quarantine followed by 7 days of home isolation. Also issues guidelines for domestic travel. Active COVID-19 cases across the country rise to 77,103 with 57,720 recoveries and 4,021 fatalities. Globally, confirmed cases rise to over 54 lakh with over 3.45 lakh deaths and 21 lakh recoveries. We begin by getting you updates from the country first in our segment Ground Zero. Active COVID-19 cases across the country have risen to 77,103 with 57,720 recoveries and 4,021 fatalities. Maharashtra, Tamil Nadu, Gujarat and Delhi continue to be the worst affected states in the country. Indian Railways has successfully operated over 3,000 Shramik special trains to send migrant workers stranded in different parts of the country to their home states. Over 40 lakh migrant workers have been ferried to different parts of the country. Giving the information, Railways Minister Piyush Goyal urged the states to cooperate with his ministry to help the workers. Ministry of Railways also informed that it will operate 2,600 Shramik special trains over the next 10 days. It hopes to ferry 36 lakh migrant labour. Indian Railways has produced 1.2 lakh coveralls of the PPEs, 1.4 lakh litres of sanitizers and 20 lakh reusable face masks or face covers during the lockdown period. IRCTC and Railways have also mobilized resources to ensure regular supply of meals and water to the Shramik special trains and minimize any inconvenience which is being caused to the passengers. And Indian skies have opened up for domestic passenger services from today after a gap of 2 months. Flights resumed their operations from many airports early in the morning, which included from Pune, Delhi and Mumbai, in Maharashtra, Ahmedabad in Gujarat, Bhubaneswar Airport in Odisha and Chennai Airport in Tamil Nadu. Passengers expressed happiness on returning home. They added that all precautionary measures are being taken to ensure safety of the passengers. All scheduled commercial passenger flights have been suspended since March 25th, when the government imposed a nationwide lockdown to curb COVID-19 pandemic. The government has also given states the power to develop their own protocol with regard to the quarantine and isolation. As per their assessment, it was announced last Thursday that 1/3 of the pre-lockdown domestic flights will operate from Monday. All international scheduled commercial passenger flights, however, remain suspended.
ऐसा सिचुएशन बेटर है और प्रिकॉशनरी तरीके से चीज़ें सारी मेंटेन हो रही हैं एंड पॉसिबली एवरी काइंड ऑफ स्टूडेंट जितने हैं सभी के लिए राहत है कि हमें जाने को मिल रहा है ना, जो कि बहुत इंपॉर्टेंट है। मे बी प्रोफेशनल्स हैं, चाहे वो 2-3 साल से जॉब कर रहे हैं एंड अच्छे तरीके से सारे काम हो रहे हैं एयरपोर्ट पर। आई कैन सी दैट।
ये अच्छा लग रहा है, 2 महीने से दिल्ली में फंसे हुए थे और अभी जाने का मौका मिल रहा है तो बहुत खुशी हो रही है। 3 घंटे पहले पहुंचना है एयरपोर्ट, मिनिमम 2 घंटे और मैक्सिमम 4 घंटे। और उसके और एक कैब में 2 लोग से ज़्यादा अलाउ नहीं हुए, तो मैं अकेला कैब करके आया हूँ यहाँ पे।
At Bhubaneswar Airport, the authorities conducted a trial run with all stakeholders participating in the entire process from entry of passengers to boarding, while ensuring that all COVID-19 guidelines are followed. Sanitizers and wash basins were adequately arranged at different places of the airport. Trolleys, trays, extra machines and counters were sanitized. And passengers at Chennai International Airport observe social distancing. The number of incoming passenger flights to Chennai is restricted to 25 per day. Chennai Airport will ensure touch-free flying experience for passengers. And up next, we'll take a look at some important facts regarding domestic flight resumption. Now, domestic flights from all states except for Andhra Pradesh, which will start from May 26th, and West Bengal from May 28th, have recommenced operations from today. There will be limited flights from Mumbai as per the approved one-third schedule from other airports in the state. For Tamil Nadu, there will be maximum of 25 arrivals in Chennai, but there is no limit on the number of departures. For other airports in Tamil Nadu, flights will operate as in other parts of the country. Airports across the country are prepared to ensure the safety of air travelers, with contactless and digitized air travel becoming the new normal. Food and beverage and retail outlets are open at Indira Gandhi International Airport Terminal 3. It must be noted that all international scheduled commercial passenger flights remain suspended. And up next, we'll take a look at the standard operating procedure on resumption of the flights. Now, this includes limited operations, that is one-third to be permitted. Airlines have to adhere to the lower and upper limit of the fares prescribed by the ministry during the period of COVID-19 pandemic. No physical check-in at the airport counters would be allowed. In fact, passengers with confirmed web check-ins will be allowed at the airport. Self-declaration with Arogya Setu app status is mandatory. Children below 14 years, however, are exempted. Passengers need to wear protective gear, that is face masks, throughout the journey. No meal services will be provided on board, and no on-board sale of any item will be permitted. Passengers are not permitted to consume any eatables inside the aircraft. No papers or magazines will be available in the aircraft. The cabin crew is required to wear full protective suit. Airline to do health checkup of all the crew members regularly. Frontline airline staff at the counters have to wear mandatory protective gear, and they have to ensure social distancing while accepting baggage. Initially, the passengers would be entitled to carry one hand baggage and one checked-in baggage. Use of baggage trolleys has to be minimized. Passengers have to report at the airport 2 hours before the departure time. Boarding will commence 60 minutes before departure, and the gates will be closed 20 minutes before the departure. Staggered sequential boarding in the batches of 10 is to be practiced. Body temperature screening of passengers entering into the terminal area and at boarding point have to be ensured. Passengers to travel in authorized taxis or personal vehicles following the norms specified by the Ministry of Home Affairs. Passengers to adhere to the social distancing norms, which would be specified at the airports through markings like circles. Airports to ensure easy availability of hand sanitizers at all entry and touch points. Also, the airports have to ensure sanitization of the buses used by passengers at regular intervals, and all washrooms at the airports have to be sanitized continuously. If any passenger feels uncomfortable, fatigued or has cough, it should be brought to the notice of the crew member for further handling of the passenger. Vulnerable persons such as very elderly people with comorbidities, pregnant women, passengers with ailments are advised to avoid air travel as of now. Airlines to ensure that aircrafts are sanitized after every trip and also at the end of the day. And in some more good news, the Civil Aviation Ministry has announced the calibrated resumption of Udan flights. Civil Aviation Minister Hardeep Singh Puri tweeted, and I quote him, "Preference being given to flights connecting Northeast region, hill states, islands and short-haul routes. Further details will be issued by the ministry." Let's get you an update on Vande Bharat mission. Now, many Indians stranded overseas continue to be repatriated as part of the Vande Bharat mission. More than 30,000 stranded Indians through Vande Bharat flights have come back to the country since May 6th. Yesterday, 680 more people have returned on 3 flights from Toronto, Singapore and London. Latest flights to arrive under Vande Bharat mission was from Muscat, which landed at Gaya airport today. 132 passengers were on board, including 116 who stayed in Bihar, while 16 went to Jharkhand. Earlier, a special flight from London landed first in Mumbai and then at Indore. 93 passengers were on board. These passengers will be quarantined for 14 days. Also, a flight landed in Mumbai and Bengaluru from Manila. The passengers expressed happiness and thanked the government. A flight also landed in Kochi from Singapore yesterday evening. And Doha Gaya Vande Bharat flight will return with 146 passengers on board, while Air India flight from Moscow for Delhi is scheduled for 11:50 a.m. today, but it has been delayed by up to 24 hours due to technical reasons. The Embassy of India in Russia will inform about the revised time of departure. And up next, we get you our segment Good News, wherein we get you reports which have that feel-good factor, which tell us that hope and positivity still live on during these distressing times. Maharashtra topped the number of confirmed cases of COVID-19 in the country, but Sangli district in Maharashtra is setting an example of how to act responsibly to fight the big challenge. Kanadwadi Gram Panchayat in Sangli, which has over 90% population as farmers, is following self-discipline, which helps greatly in fighting COVID-19. As soon as the news of COVID-19 spread in the country, the Gram Sabha was convened and 3 of the 4 entry routes to the village were immediately closed. The villagers started a visual campaign with the administration in spreading awareness about the virus. Sanitization of the vehicles and quarantine facilities were also arranged for visitors from outside the village. The villagers complied by all the guidelines of the central and the state government.
पूरा गांव इकट्ठा होके गांव एक घर समझ के हमने 4 रास्ते से 3 रास्ते ब्लॉक करके एक ही रास्ते पे चेक पोस्ट बनाया है और बाहर के एक भी व्यक्ति को हमने अंदर आने नहीं दिया। लोगों से हम निवेदन करते अब सैनिटाइजर का हमने हर घर में सैनिटाइजर मास्क को बांट दिया है और सोशल डिस्टेंसिंग पालते हैं।
All right, the Sangli district there setting an example for others to follow. In Arunachal Pradesh, economic activities including farming are taking place in all parts of the state. Amidst rainy season, paddy farming has already begun, while maize farmers are taking care of their growing crop in the field. In Lohit district, besides farming, other economic activities, mainly construction works, have also started, and mechanics are getting work in their motor garage.
इतना दिन से लॉकडाउन था, लॉकडाउन की वजह से हम लोग के पास पैसा वैसा बहुत कमती हो गया। पैसा वैसा है नहीं, खाने के लिए कुछ है नहीं। हम लोग का सहारा वही है, गैरेज से हम लोग का सहारा, क्योंकि हम लोग काम करने से 2 रुपये मिलता है, तभी हम लोग खाता है, क्योंकि काम नहीं करने से पैसा नहीं मिलता है।
मतलब लॉकडाउन का पहले मतलब 1-2 रुपये कमाया था तो वही खा के बैठा है। तो अभी फिर से अभी लॉकडाउन नॉर्मल हुआ था, लग गया मतलब काम पे। अभी था पैसा निकालना पड़ेगा अभी ना, अपना पेट पालने के लिए।
लॉकडाउन में कुछ भी नहीं मिला है, तो गवर्नमेंट ने हम लोग को चावल दिया है, वो से थोड़ा हम लोग बचे हैं। अभी तो नॉर्मल हुआ है लॉकडाउन जो, तो अभी हम लोग यहाँ में मम्मी का मदद कर रहे हैं।
All right, life limping back to normalcy there in Arunachal Pradesh. And COVID-19 outbreak may have dampened Eid celebrations across the country, but it could not dampen the spirit of the festival. Yes, people were seen wearing masks and following social distancing norms while offering prayers. And women in Varanasi are celebrating their Eid in a unique way. The festivities, though hampered by COVID-19 fears, yet some want to bring smile on people's face during Eid. Huma Banu prepares Eid special kit for people who are needy and are unable to celebrate the festival. This kit includes sevai, sweets, biscuits, ghee, so that the underprivileged ones can also celebrate Eid with fervor during the lockdown.
आज ईद का मतलब मौका है और हमारा देश ऐसे दौर से गुजर रहा है जहाँ की कुछ लोग ईद की खुशियाँ मना नहीं पा रहे हैं और ऐसे लोगों को हम लोग असहाय लोगों को हम लोग मदद कर रहे हैं ईद की किट देके अपनी ईद घर में मनाएं और सबसे बड़ी बात कि हाथ ना मिलाएं, गले ना मिलाएं, दिलों से खुशियाँ मनाएं।
देश इस दौर से गुजर रहा है जिससे सब हर कोई परेशान है, इसलिए अल्लाह से दुआ है कि कोरोना जल्द से जल्द पूरे मुसलमान की दुआ जल्द से जल्द ख़त्म हो जाए, हार जाए, हम लोग फिर से सही हो जाए।
पहले ईद की मुबारकबाद देना चाहती हूँ और सबसे यही कहती हूँ कि सारे कोरोना और जो भी ये बीमारियाँ हैं सारी दूर हो जाएं और हम मुसलमान सब मिलके अपना हंसी खुशी अपना ईद का त्यौहार मनाएं।
ईद जैसा त्यौहार है जो बहुत धूमधाम से मनाई जाती है, तो फिलहाल इस जो बीमारी की वजह से हमारे ईद नहीं मन पा रहे हैं, तो हम सारे मुसलमान दुआ करते हैं कि रमज़ान के सदके ये कोरोना वजह से हमारी खात्मा हो जाए। इंशाअल्लाह ज़रूर हमारा देश जीतेगा।
All right, the spirits there marking the celebrations of Eid across the country. Up next, we'll take a look at the global developments on COVID-19 in our segment World Wrap. Globally, the confirmed cases of COVID-19 have risen to over 53 lakh, with over 3.4 lakh deaths and 21 lakh recoveries. The worst affected United States has almost close to 1 lakh deaths. The total number of COVID-19 cases in the US has crossed the 1.6 million mark, while the death toll stands at 97,686. Meanwhile, the White House has announced that it is prohibiting travel to Brazil as the death toll continues to rise. Countries where travel has already been banned by the US include Europe, United Kingdom and China. New restrictions would help ensure foreign nationals do not bring additional infections to the US, but would not apply to the flow of commerce between the two countries. And Brazil has confirmed more than 3,63,000 cases of COVID-19, with over 22,600 deaths, becoming the world's second worst hit country. The actual number of cases and deaths is believed to be higher than the official figures disclosed by the government, as Brazil's testing capacity still lags behind. And UK Prime Minister Boris Johnson said that the government plans to reopen the primary schools on 1st of June as the government seeks to loosen the lockdown measures imposed to stop the spread of COVID-19. Schools were closed since March 20th, except for key workers, as COVID-19 cases had surged in the United Kingdom. Speaking at the daily briefing, Prime Minister said that he was setting out the government's intention so that teachers and parents could plan in earnest for the schools to resume in just over a week. He said that the formal decision would be taken as part of the 3-week review into the lockdown measures. Meanwhile, teaching unions have expressed concerns over the safety of bringing students back into the classrooms this early. However, UK has reported over 2.6 lakh COVID-19 cases and more than 36,000 deaths so far. A team of Chinese epidemiology experts have arrived in Peru to collaborate with its health authorities in the fight against COVID-19. The visiting doctors will exchange knowledge with doctors and health experts of Peru on COVID-19 prevention, control, treatment, care and research. The Peruvian government has adopted a state of emergency, including quarantine and curfew of 70 days since March 16th, but has extended until June 30th to control the virus's outbreak. However, Peru has reported over 1,19,000 COVID-19 cases and 3,456 deaths so far. And Italy's lagoon city of Venice has welcomed back tourists after the easing of lockdown restrictions. Italy will reopen its borders to European Union states next week, while residents of the Veneto region were the first to visit Venice after the lockdown. As COVID-19 pandemic has halted tourism industry, Venice had to suffer from huge economic crisis over the lockdown period. In March, local authorities had suspended the final 2 days of the famous Venice Carnival and postponed a 3-week-long film shoot. Now, Italy is heavily dependent on tourism, which accounts 13% of its GDP and employs nearly 13% of the country's total workforce. However, Italy has reported at least 32,785 deaths and more than 2.29 lakh cases since the outbreak of COVID-19. Afghanistan's President Ashraf Ghani has welcomed Taliban's ceasefire announcement and extended the offer of peace. Speaking at the presidential palace right after observing Eid al-Fitr prayers, Ghani promised that the government will accelerate the process of releasing Taliban and asked the hardline Islamist group to do so. The Taliban declared a 3-day Eid ceasefire in Afghanistan starting Sunday via a tweet from the hardline Islamist group, and the country's president said that the government would reciprocate. The move came as fighting between the two sides had intensified despite the COVID-19 pandemic. Saudi Arabia's Grand Mosque in Mecca was almost empty during the annual Eid al-Fitr prayers on Sunday as authorities impose unprecedented restrictions on public gatherings due to COVID-19 concerns. A small number of worshippers attended the prayers to mark the Eid al-Fitr festival, the end of the holy fasting month of Ramadan. Now, Saudi officials on Friday said that mosques would remain closed for the festival and urged Muslims to hold Eid prayers at home. Those were the global updates on the pandemic. And up next, we get you Doctors Speak, a segment wherein we get you advice from the doctors which help you cope with these distressing times. While the nose and mouth are the main avenues by which someone catches COVID-19, the possibility of acquiring it on the surface of your eye is also possible. A new study has suggested that COVID-19 can also be transmitted through the eyes. The doctors say that even eyes need protection against COVID-19 infection. Health workers should wear visors for eye protection.
People have now know that they have to cover their face and nose, but they don't realize the eyes are also to be protected, because eye also has a mucous membrane like conjunctiva, which can get infected by this virus, and that can be a source of spreading infection to other people also. So today, I think it is important to realize by people that they have to protect their eyes. They should wear goggles whenever they're going outside and protect themselves from touching, rubbing their eyes also, because that can be a source. And even people having a upper or lower respiratory tract infection, because there's a connection from nose to eyes also, through the connection they have, and the virus can travel through the nose to eyes also. So if you don't have eye symptoms also, you can still have a viruses in the ocular surface. So it is a very important message for people to realize that they have to protect their eyes also.
Well, it's important advice coming in from the doctors there. Remember, the only way to keep COVID-19 at bay is to take precautions and to ensure that you are safe. Along with that, your near and dear ones are safe. Follow the norms of social distancing. Stay at home. Stay at home all the time unless it is very important to step out. Added to that, maintain personal hygiene. Wash your hands. Use sanitizers. Also, wear face masks and keep yourself covered and protected. With those words of caution, we'll end this edition of Tracking COVID-19 here. Thanks for watching. Namaskar.